So welcome back, CardioNerds. This is Bruni Kaur, resident at Brigham and Women's Hospital. We're back with our Narratives in Cardiology series designed to promote diversity and inclusion in cardiology because our differences make us stronger. I'm here with Dr. Chelsea Twaniboa, CardioNerds Academy intern and internal medicine resident at Stony. Today, Air Force CardioNerds will be descending into Georgia to talk with Dr. Heval Kelli.
Thank you for that, Curly. It's such an honor to welcome Dr. Heval Kelli to represent the Georgia chapter for Narratives in Cardiology series. Dr. Kelli is a board-certified internal medicine physician and cardiologist who specializes in non-invasive cardiology at the Northside Hospital Cardiovascular Institute in Lawrenceville, Georgia. His expertise includes preventive health, serving underserved communities, refugee health, and utilizing artificial intelligence in healthcare. He's a former Syrian Kurdish refugee whose family arrived in Germany in 1996 and lived in refugee camps until 2001, when they moved to the United States 2 weeks after 9/11. He completed his undergraduate studies at Georgia State University. He then went on to Morehouse School of Medicine, where he graduated cum laude and was selected as the most inspiring person. He subsequently went on to finish his internal medicine residency at Emory University, where he received recognition as Resident of the Year and distinction in social and inpatient medicine. He completed his cardiology fellowship at Emory University in 2020, where he was also awarded the CAP Foundation Fellowship in Preventive Cardiology. Dr. Kelli is also the main character of the documentary titled Refugee that has also received numerous awards. Dr. Heval Kelli, once again, let me reiterate that it is such an honor to have you with us here today. Welcome to the CardioNerds. We are so excited to learn about you and your inspiring journey tonight. So thank you.
No, thank you very much for having me here. I was telling my wife that I'm on CardioNerds. She was like, that's so cool. So my wife is impressed and she's been following you guys closely on social media for years.
Thank you so much, Dr. Kelli, for those kind words. We're really excited to have you here with us today and really hear about your inspiring journey. We touched a little bit about this briefly in your introduction already, but you arrived in the United States just 2 weeks after 9/11, and that time was the height of the American population having distrust with the Middle East. Could you take us through your journey as a Syrian Kurd fleeing your home to live in refugee camps and then arriving in the U.S.? How were those first few years like?
Yes, I mean, I'm a Kurd, and the Kurdish minority group is one of probably the second, civilized group without a country, like in the history of mankind. We are pretty much divided among four major countries: Iraq, Syria, Iran, and Turkey. And we lived in the Syrian part. And as a minority, you always have been oppressed, in those regions. And because of my father was a lawyer, he was, tortured by the government, and we had to leave because it wasn't safe. And I was 11 at that time. I remember when the police stormed our house and kind of destroyed everything. And then we moved to Germany as refugees there on asylum. We lived there for 6 years. It was an interesting experience because we were on this asylum status of, applying every 6 months for an extension with a fear of being shipped back to Syria. And through some church member who recommended to apply to the US, after 2 years of, I guess, extreme vetting of going back to the embassy, we were accepted to the United States, which gave us some hope. But then 9/11 happened. So it was kind of like, all the hopes were gone. But then September 21st, we get a call. He said, we have 2 days left to go to the US and your ticket's been ready. As you were supposed to be told on September 10 when to come to the US. And then, 9/11 happened. So we packed our clothes, and with no family and friends in the United States, we arrived in Atlanta, Georgia, in a small town called Clarkston, which is pretty known right now for its diversity, right 10 minutes down the street from Emory. And, I arrived here at the age of 18 as a high school senior with no friends, no family. And, and you, when you come to the US as a refugee, you only get about 3 to 6 months of support from the government. So they expect you in 6 months to learn the language, get a driver's license, get a job, be independent, and take care of yourself. Well, the American dream didn't really start for us because my dad had a heart attack first couple of weeks in the United States. My mom is a 45-year-old Muslim woman with a hijab, wasn't an ideal candidate for a job around that time. So I had to pick a job as just washing dishes, putting 40 hours a weekend in while trying to learn English, go to high school. But I was very blessed by many Americans coming helping us along the journey. And then I say people, I went to Georgia State, Morehouse, and then Emory. And, in 10 years span, I say I'm the slowest walker. I walked from the restaurant down the block to Emory University, start a residency there. I always made sure I went back with my Emory ID and my free drinks. So that's kind of my journey coming to the US and how I got to cardiology across that time. But it is definitely challenging, when you come as a refugee, you're not living in privileged neighborhood, you're living in underserved communities where, I say to people, a refugee is just a poor American who hasn't learned English yet. Once you learn English, you're still dealing with the same issue of, poor education. Just to give you insight, my high school, Clarkson High School, over the span of 20 years, only 3 people became doctors. And that high school is only 15 minutes down the street from Emory. So it kind of gives you the whole disparity of how these communities struggle. And we face the same thing. My neighbors weren't doctors and lawyers and nurses. My neighbors were, low income, members of the community. So it was definitely very challenging in the beginning.
Thank you for that. Definitely learned a lot. Thank you. But I just want to ask a few questions concerning your documentary, Dr. Kelly. So in your documentary, which I also recommend that anyone who haven't watched it to go watch it. There's a lot to learn from it. There's a mention prior to you arriving in the United States, your family also had an experience with hate groups back home. You mentioned that due to these experiences, when you also carried hate within you. However, when you first meet Chris in the documentary, your approach is one that is inviting, and you're able to show him the perspective of your life despite his initial reservations about you. And for everyone else on the call who hasn't yet watched the film, Chris is a father, a veteran, and a former KKK member whose deep prejudice against Muslims is challenged when he meets Dr. Kelli. Dr. Kelli, your ability to give Chris more perspective is highly commendable. And this is particularly relevant for us in medicine as physicians, where we encounter patients and colleagues from all different backgrounds. And it's important for us to understand each individual's unique experiences. So how are you able to let go of the hate that you carried, and what made you choose to approach others like Chris in this manner?
That's a very good question, a deep question. Just FYI, actually the documentary is on all Delta flight across the nation and internationally. So I think I get called from my colleague I haven't seen for 10 years. Oh, I saw you. And I kind of joke with him. That's like fake news. It's not me as an AI version. So it's on Delta if you don't get to watch it on Amazon. But, when I was in Syria, I had to leave everything. We lived a very privileged life, and leaving everything and coming to a country like Germany where we lived in refugee camp, that carries some anger, and that anger distilled into hate. Especially when I was in Germany, I was a target of a lot of, kids in school being bullied because I look different. I was the only brown Muslim kid in the school in a town of 2,000 people in the middle of the snow. So this kind of creates that target of prejudice. And you leave in essence again, and you have to leave Germany again because they don't accept you. So you leave with all this anger and hate. And when you come to the US, you're like, okay, well, life doesn't look great either. Like I have to struggle and pay the bills and work. But a lot of Americans taught me like what it means to integrate. To be honest with you, when we came here the first week, we had these Christian, church member came to my house, knocked on the door and welcomed us and took us to Walmart and came and taught us English and hosted a party for us. And I kept thinking, here's a Muslim family just right after 9/11, and here are these Southern Christian, Americans who were, their country just got attacked, and they're coming to welcome us. Something special about this country, like something different from any other country in the world I did not experience. And I think that was the first step of me saying, hey, maybe there's hope in the world. Maybe we can make a difference. And I think that carried me through my career. And eventually when I met Chris and how I work with him. So it was not just, I always had my own problem of prejudice, I think, but experience the American story and American dream really made me change my perspective about things.
Thank you so much for sharing your journey and the experience of coming to a new place and starting over and being different. And also how you mentioned that your neighborhood was the one that had many people go on to become physicians or lawyers or some of those kind of jobs. And it's really inspiring that I went from coming from that experience and learning English and being an immigrant to becoming a distinguished cardiologist. And I think we talk a lot about this, that there's a lot of rhetoric in the US about how immigrants steal jobs for citizens, and especially when some of these groups achieve a lifestyle that is better than the lifestyle of other people. So in your journey, would you say that you came across any circumstances in which others made you feel that way? And tell us more about how you came from that environment and your journey to becoming a physician and cardiologist. What got you interested in the field, and what were the challenges? Because I can't imagine that it was an easy journey and probably a lot went into it.
I was very fortunate and blessed, and, again, if it was only just hard work and intelligent, everyone will be successful. It's not that easy. It's like you could be the hardest working person and you could be very smart, but if the opportunity don't come to you or not presented to you, it's very hard to make it out of those neighborhoods. And that's something stuck with me, that I was lucky that someone like, I remember Dr. Latouf, who's a cardiothoracic surgeon at Emory, who through his daughter, who knew my brother, who was a soccer player in one of the schools she went to, who my brother told her, hey, my brother is a dishwasher, he wants to be a doctor. And during dinner, she convinced her dad to call me. And her dad got my number from his soccer coach's assistant. So just to give you like all of these lucky patterns, the guy calls me and say, hey, I want to meet you. I thought first he must be like an agent for the Syrian government because, he was Middle Eastern himself. I was like, why would this guy call me? Why would a heart surgeon wants to talk to me? He invited me to meet, and he invited me to his house. And when I drove to his neighborhood, it looked like I'm the gardener with my little bumped up Toyota Camry. But, his humility sitting with me and asking me a question about my dream and talking about what I want to do as a college student really taught me something special. I'm like, well, if this guy who's a very prominent surgeon taking the time to talk to me, I need to be like him during my journey. So every step of the way, I looked behind. When I was in college, I was helping high school students getting in. When I was in med school, I was trying to help pre-med get in. And when I became a fellow and resident, I was doing the same thing. And that's how I always went back to the community. Because, like I always believe that if someone opened the door for you, you got to hold the door for the next generation. Because if you just walk through that door and close it, you just close another major door for many people behind you. And I think that requires humility and making yourself believe there's not just hard work and it's not just intelligence that got you there. There's a blessing from higher up, and also people came in your life to help you. So instead of making a matter of luck, just make an opportunity for everyone else.
That's very important. The lesson that you just spoke about there, creating opportunities for others. And I think a lot of your work reflects that. In addition to that, I know that as a cardiologist, you also are an advocate. You've also chosen to make part of your life's work speaking out against hate. How do you think your two worlds intersect between cardiology and speaking out against hate? And how does this work influence your career as a physician so far?
It was a very challenging time, right? As a physician, you have to always be careful what you engage in. And we have, we are always under the, watch because, we are a very professional, group of people in the society, and we take care of people's family members. So how you present yourself in the public is very important. And I think it was just, for me, it was a matter of like, I was forced into the opportunity. It was around the Trump election, and I was noticing there was a lot of anti-refugee and immigration rhetoric coming out. And I was kind of shocked. I was like, well, wait a second. I came here after 9/11. I was welcomed by the same people who's saying right now, we don't need more refugees and immigrants. Something's wrong here. Is it my fault that I'm not advocating enough? Because, I could be, this cardiologist living in a nice neighborhood and I'm protected. But hate make us realize no matter how privileged you are, you're not protected. You could live in the mountain, isolated from everything else, and still hate will get to you. If it doesn't get to you, it's going to get to your kids. So I feel like, I'm having a child coming away right now. If I don't do something right now to advocate, my kid will ask me 20 years, what did you do about this problem? And again, as a refugee right now, who's an educated refugee, financially stable, if I'm not the one who's advocating, do I expect the guy who's a cashier worker trying to survive in a neighborhood to advocate for themselves? It doesn't make sense. So I had to step in the public. And what I learned also is you can't be just part of like, pointing finger at each other. If you're just saying I'm part of this against you, you're really not making a difference. You got to reach out to the other side and figure out like why these people don't like you. What is it something? And I'm a big believer, it's very hard to hate something you know. So that's why I had to make myself visible and available to this community and kind of start interacting and learning where this hate coming from. And this is not the fabric of this country. I know we have our own history, but we have moved through some of these problems throughout history. So we need to figure out a way to come to the table and find some common ground. And I think the experience with Chris, that was very important. And I think a lot of physicians, we forget that when we are in the public and people recognize we are doctors, we have these really superhero kind of like invisible, like, power that people we don't recognize many times. Like people look up to us. Imagine you sit in a room telling people, "I'm going to put you on lisinopril for the risk for angioedema." That person's willing to take the risk for you because you tell them it's the right thing to do. Now use that same rhetoric and power of convincing people that we should look into each other, sit on the ground, let's talk to each other, let's interact. When we think about it, when we are the best social advocate because people trust us. It's the most trusting professional in the world. So using that power, using that privilege, and thus recognizing those privileges we have, really we can make a difference beyond the exam room.
Thank you, Dr. Kelli, for sharing how we can really leverage that trust that other people like patients have and love, doing that to good use. And I really liked what you said about if someone like opens the door for you, pull the door for the next generation. I think that's just a very powerful statement because I think sometimes people don't go into a field because they don't see someone like themselves. If people see someone like themselves and are able to talk to people like you, they're more likely to aspire to be someone like the person that they're looking up to. And that's been one of our missions for this here in cardiology series is making people more comfortable having these conversations about how other people might be different and recognizing the challenges that others face when they're trying to establish themselves in medicine or cardiology so that our field overall can become more inclusive. And with the current state of events right now, we are often dealing with a sense of hate amongst different groups of people towards one another. And it seems like this kind of cycle repeats every few years with different types of groups. And we know that even in medicine and cardiology, structural racism and hate is apparent. And I want to hear from your perspective, how do you think as current and future cardiologists, we can really work towards making our workplace more inclusive and trying to eliminate hate from that environment?
One of the things that challenged with the Chris in this community was for me to prove myself. It's like, I'm not an interventional cardiologist, but imagine if you went in the case of STEMI and this is the complex patient and you want to I'm going to test my skills at the best with this complicated case and I make sure the patient survive. If I could do this, I could do anything. Same thing with me. I'm going to go for the worst of the worst. And it was, Chris was a KKK leader in Georgia. The worst it could get. And he said to people, I will talk to Blacks and Hispanic, but I would not talk to Muslims because he lost his friend in Afghanistan. And we started talking on social media. And, I started talking to him and I realized he was a veteran. I told him I was working in the VA and I was doing some moonlighting there. And then we started developing some common ground. He had a child, I had a child. We had love for certain things. And eventually he moved to the middle. And now he's actually a super advocate for anti-hate, and he travels the nation and speaks. And our relationship flourished for him into creating a program to help others to leave hate. That's the same thing I carried on with Chris. If I could show compassion to Chris, we could do the same thing in our workplace. The thing about that strike me a lot of time in medicine is we have this thing, when it comes to our patient, we walk in the room to a stranger and we are so trying to be compassionate, understand what they're going on. But for some reason, that compassion doesn't translate to our colleagues sometimes. We feel like we all have to be tough. I suffer, you need to suffer. I was on a 24-hour call Q2 in my 20 years ago. You got to do the same thing. But the world's changed, it's not the same. I think we need to start by being shown compassion, humility to each other. I always tell my residents, I was like, you walk in a room and you're so nice to Mrs. Smith, but you need to be the same way nice to your colleague too. For example, I think one of the things that we have still a long way to go when it comes to female, advocacy and, especially when pregnancy. I remember when I had a pregnant fellow and I will go to her, be like, hey, if you need to take off, I cover you. If you need to leave early, I got you. Let me know if you want to switch your schedule. And I think it starts with these small things. We need to be compassionate and show humility to each other first before even we show that to our patient. But somehow the reverse always happened. And it kind of to me, I try to always teach my intern and resident and co-fellow when I was with him. That's the first step. Compassion start with the neighbor next to you first. And then you go to the world and show it. I think if we practice that, the humility and compassion in our workplace, it will make it more inclusive and people feel more welcome.
A very important point you made there. I think one thing I noticed in the film was how you and Chris were able to create this friendship in the midst of all this tension that was going on around you. And like you also said, being compassionate to our colleagues. I don't think we're often taught that enough in medical school and in residency and beyond. We're always taught to be compassionate and show empathy to our patients rather than each other. So going off of that, I was curious if you may offer some insight into how we as physicians can navigate sensitive issues, especially looking at our current political environment today. I mean, if we put on the news today, you can see what's going on in our world and in different parts of the country. Not much different from when you arrived in America a few years ago. So by looking at our current political environment and our social issues that we're facing in America, physicians may often be scared to be engaged or offer their opinion concerning issues due to fears of being judged or labeled. How do you think we as physicians can properly navigate these issues without being polarizing or offensive?
I mean, to me, I use, different methods. I use compassion, humility, especially when I approach someone who is not in my profession, and they showing prejudice toward me. I focus on my service. I've been in a place, I remember recently, there was a guy walking the shore says, veterans over refugees, and I went in a room, I took care of, the patient's family. I show respect. I explain everything to them. And by the end of the conversation, I was like, by the way, I happen to be a refugee. I came to the United States. And the guy was like in shock. He's like, well, I'm talking about the other refugees. I'm like, well, I was the other refugee. I was exactly that refugee that maybe wasn't of value to this country. I was 18 years old, Muslim refugee. And something clicked. And when I left, the nurse practitioner told me of the emergency room, was like, hey, he apologized about his shirt. Again, that guy wore the shirt publicly, openly, but I walked in there. I didn't argue with him. I just showed my service toward the respect to other family. And I think that's a very powerful thing. The story, if you watch the movie, Arno, the guy who was actually a leader of the neo-Nazis in the West Coast, the way he changed and left that group is by his neighbor showing compassion toward him, who had a father who was actually killed by neo-Nazis. He was shocked how the sons and the family of that family was so compassionate, so respectful toward him, despite his presence. I think we could achieve more with service and showing compassion than like being argumentative and like picking sides. Again, there's certain situations you have to stand up. If you see, someone's getting bullied and someone getting hurt, then of course you have to stand up and stop that. But also another method, I use humor. People ask me like, always when I was in an interview, I never made a statement against a political figure. Someone asked me, why you think Trump doesn't like, refugee? I was like, maybe because he hasn't tried my mother's food yet. We got better season, we got better spices. If he tries my mom's food, it's going to be very hard for him to try refugee. So also you could use humor and to kind of calm down the situation. It's like the physician, you walk in the room, everyone's very tense. If you tense at the same time, the whole room is going to be much more tense and you can't really get anything done. Sometimes physicians just have to calm down things, walk in there with respect, show them that you know what's going on, you got this situation taken care of, and everyone will start calming down and listening. I think there's a different way to use that to kind of find common ground. In the end, we all humans and we all breathe the same air, have the same blood. And, when you look at someone's echo, you can't really know if they're black and white. So I think that's how we should approach this situation, by humility and compassion and service and a touch of humor.
Thank you for sharing that, Dr. Kelli. And it's just really inspiring how you reflect so positively on your tough experiences too, and really have been someone that's compassionate and kind of finds common ground with everyone on the situation that arises. And you've been a really strong advocate for serving the immigrant and refugee and minority communities. And as you mentioned, you really tried to give back to where you came from, and founded also several nonprofits that are focused on medical mentorship and healthcare outreach, including a young professionals initiative that focuses on an after-school program at your former high school with focus on mentorship. Meaning the common theme that I'm noticing between all these organizations, and also from what you were talking about earlier, is that it's about providing access to resources and information despite one's background, so other people from neighborhoods like yours can also aspire and become physicians. And it really means a lot when people like yourself invest in the community. And I think we talk a lot about this in cardiology, about the leaky pipeline, and how it's so important to start early to get people into medicine and cardiology, not just during residency or during medical school, but even earlier on, like in high school. And you've done that through your program. So what do you think from your perspective, what are the biggest barriers or obstacles that are hindering people from entering the fields of medicine or cardiology? And how can we as a collective, you and us, seek to address these matters? And what are other ways to help the workforce in cardiology become more diverse so that it's more inclusive to first-generation students, refugees, and other minority populations?
That's a great point you bring up. And for me, it was like when I went back to my community, my high school, and spoke, and how they told me only a few people became doctor. And I thought that was pretty devastating, because, you don't, you feel good about yourself, you accomplish something, but then you look around, you're like, I'm one of the very few people who did it. Good for you, but what about for the community? And at the same time, I was volunteering in the community. I was seeing people with, hypertension, hyperlipidemia, and diabetes, and I was writing prescription, treating them. But I thought about, like, I could do this all day long, but I'm not making much of a difference. I need to create more people like me. The reason I'm back to this community because I'm from that community. How about more people from this community become doctors, nurses, nurse practitioners, PAs? We could help so many people more. The pipeline could be leaky. There could be 100 pipeline in a community. If the kids are not inspired to go through the pipeline, then it's really, the pipeline is useless at this time. So we need to make these kids believe they could be part of us. Because when you look at medicine, over 60, 70% of medical students come from privileged background. So the medical school is not representing these kids. But our worst patient with the worst outcome technique, I'm saying the worst outcome patient, are actually people from underserved communities. So medicine is not reflecting those communities. So I feel like I need to just feed the pipeline. I'm going to try to inspire as many kids I can to get into the pipeline. Even if it's leaky, the pipeline will be packed. So we get these kids into medical school. And I started as a fellow in Clarkson High School with one medical students. We built a curriculum around the medical student, teaching them, because if I tell everyone, if your mentorship program is revolving around a doctor, it's just prone to failure, because the second a doctor doesn't have time to run this show, that program is stopped. But what a better advocate is the med student. The med student knows how to get into med school. They just took the MCAT. They know exactly the process. So we use the medical student teacher curriculum by inviting the doctor to speak. And I think right now we're on 20 plus locations around Georgia. We have some pilot in Miami, Chicago, and Tufts Medical School. So we leverage a program to end with minimal funding. If I show my budget of the program and how it's running, you'll be shocked. It's like a very minimally funded, privately funded by a foundation, Georgia ACC. The ACC gave us some grant. So we've been very good at like taking the best out of the budget and, and bringing the program to almost 20 plus high school and colleges across the state. And now our program is run by the medical students who actually were pre-meds when they came to our session. So it's kind of a residency program. That's how we created a residency program for feeding the pipeline. And, I tell people, like, I don't believe in helicopter mission. I don't believe just going to the community to do something for a day and leave. I feel like we need to find sustainable way to stay with the community, because that's the only way you can build trust and how you create more success. So that's my model. And it was all inspired because I was like, we need to get more people like me and myself and other from my community into medicine.
Thank you. I think that's so important. Not only increasing diversity in medicine, especially having these people eventually, as future physicians, come back to their communities and solve the very issues that we see in medicine today, especially the more serious diseases that we encounter in medicine. So not only do you have interest in creating access and increasing diversity in medicine, but I see that you also have interest in refugee cardiovascular health. So curious to see if you may be able to expand on the specific disparities that exist within refugee cardiovascular health, and how we as the cardiovascular community can work to address these issues.
It's tough because, refugees and immigrants, they come from countries where prevention doesn't exist. Going to the doctor is like when I'm sick. Like the mentality of going to the doctor, check your cholesterol and A1C and just make sure you're okay, even though you feel good. That concept does not exist in many countries. So I always tell all my colleagues, just keep that in mind. Like, getting refugees and educating their kids and family just to get into the clinic to get their number checked is a big deal. To get them to check their blood pressure when they're not feeling sick, that's a big deal. So we're trying to use kind of like very simple metrics in our local community by just teaching people how to check their blood pressure, what it means to get a mammogram, what it means to just go get a colonoscopy. and teaching the kids, because honestly, in every refugee and immigrant family, first generation, the kids are the parents. The one who speak English in the family is technically the mom and dad kind of replacement, because mom and dad trying to like survive, pay the rent, get things done for the kids. And the kids who speak English are mainly the interpreter trying to get the family through. So I would say like focus on the kids. If you got a teenager from the family who's like speaking English, that's probably the best health advocate. And you have to start very simple. And also like, right now with the age of AI and technology, providing material that is in different language should be much easier than before. And I tell people, stop using papers. I mean, every refugee has a smartphone because they use WhatsApp and Viber to call their family. Leverage technology in your favor. There's so many things you can use technology for. I teach all my immigrant refugee kids, take a picture of your medication. Just line them up like your grandkids and take a picture and just take it to every appointment. The doctor will know exactly where you're taking. If I have a patient who has an abnormal EKG based on like a left bundle, I just make him take a picture of it and make it like put my information in your contact, and that picture profile is your EKG. So you show up in any ED, you could show them that EKG and they could know exactly that's your baseline. So this simple thing, we could leverage technology that doesn't require much language, that we can help a lot of refugees. I think the biggest barrier is the language, but also if you can find an advocate in the family, that's going to be your best advocate to make a difference in their life. I was the one person for my family. I'm the one who encouraged my mom to get a mammogram, check her A1C and lipid. I was the one who made sure my dad got to the doctor, and I was 18 years old. So it wasn't them that were trying to take care of that. It was me that trying to do that. But again, just like Americans and from underserved community, refugee with mental health issue. And that's something, a whole different topic that I think we are so behind in this country that we need to invest more. And refugee deal with this on a max level. But I see a lot of resilience, and something I'm trying to still understand. How come these people who come from the war zone, from the worst environment, come to a new country, learn a language, making ends meet, get their kids educated, and still dealing with their issues? That's something I still have to figure out how we manage in this. And the concept of resilience and things still not very well understood in medicine.
Yeah, the resilience is definitely very inspiring. And I like how you mentioned that prevention for refugees and for immigrant communities, it's important to not just forget the adults and the people who are having the disease, but starting from the kids who are oftentimes the ones that can advocate for their parents or grandparents. And you talk a little bit about leveraging technology and how we can use that to better educate patients. And I also noticed that you've done some work related to mobile health initiatives and how we can leverage technology from that standpoint to address prevention topics like metabolic health and metabolic syndrome. So from your perspective, how do you think that mobile health technology and some of your work related to that can be used to bring health education, like the one thing you mentioned, to the people that are underserved or more vulnerable in the American population?
I mean, it's by simply just, show them how to, take pictures, save it in a note area, give them the information and let them actually preserve it as a digital format. That was the biggest thing that I taught a lot of my patients. There was a lot of apps, blood pressure check apps and all that. We use that. But I think we're already beyond the mobile technology. I think AI is going to change that. I think language is going to be a relative thing in the future. I mean, there's already existing these models where you could just speak and the language in real time is getting translated. I think, working language is going to be just not an issue anymore in a few years. And I think we just need to prepare as a physician to just know how we could use AI in our favor. I always say AI is like when people stop using money using credit card, everyone's afraid that the bank will steal your money. Everyone's so afraid of AI, and I'm using it. I mean, I was telling today my wife about how ChatGPT has this now pod you could create, and I'm training it about cardiology guidelines. Literally, I could give you a very simple example. I trained the pod on all the guidelines for lipids, and I told him, give me like the most updated hypertriglyceridemia, management. It gave me like all the classes. Then I'll say, give me the drugs, gave me not only the drugs, gave me all the drugs in trial. And I say, give me all the dosing for each drug. And it did that. That took 30 seconds. In 30 seconds, while I'm talking to the patient, I could actually extract and I trained the pod to do that. And it was very accurate because it extract all the data from the guideline. So I think we should be able to use some of these technologies to make our job easier, but also serve the community in better ways too. And also the CDC does a great job actually of creating profile of certain immigrant groups and refugee and what are the main issue they're dealing with. I just recently discovered it. So The government already has a lot of good data on if you are interested in working with a certain community like the Afghani community. There's a lot of good data from the CDC on what they're dealing with and what are the main issues are actually. But get comfortable with AI. That's what I tell my physician. Not going to replace our job, but it definitely can make our job better.
Yeah, I love that you brought up the intersection between medicine and AI. I feel like there's a lot of work going on currently trying to combine healthcare and AI and trying to improve our practice. So I'm excited to see what the future holds for that. And I'm sure on this call, there's probably future aspiring cardiologists and cardiologists on the call right now. So for those interested in training in cardiology, what are some pertinent pieces of advice you feel are important to know? And in addition to that, what do you wish someone would have told you when you're applying for cardiology?
It is, and I don't want to sound old, but every year it's getting more competitive, and different specialty. And I just met a medical student from Emory who just emailed me and wanted to be a cardiologist. People already in med school start preparing for getting into cardiology fellowship because I think just, people realize it as a very diverse field. And it's almost like as a general cardiology, technically like a primary care of cardiology. There's so many subspecialty. All the structural stuff that's going on is very exciting. All the new drugs are coming out. I just tell people find a mentor, and more importantly, find a sponsor. You could find many mentors who can maybe guide you in certain aspect of cardiology, but find someone who's your advocate, who's going to say, okay, I like your story. I like your passion. I'm going to make sure you're going to join our field. You want that doctor or the mentor who's going to advocate for you. That's the most critical piece and honestly, I tell people, it is not how smart you are is going to impress people. You guys are resident. Your best intern wasn't the smartest intern. Your best intern was a person who was ready to go for round, took care of everything, show up early in the morning, stay late, done the work. That's the best doctor. Intelligence relative. Like I told you, I created a spot that could answer any question cardiology in 30 seconds. You could turn around, take a phone call, I can answer your question. So intelligence is becoming relative. I think hard work, dedication is the most important thing. Because I always used to tell my intern, I could teach you how to speak English. I could repeat my name to you 100 times. I could teach you medicine, but I cannot teach you to be on time and be professional. That's something you have to really learn from your mentors and actually learn the wrong way. So and my advice to anyone in any field, just work hard. There's no shortcuts. Just and people love to be around people who work hard and interested in the field. I know what you guys experience. I mean, you guys are right now resident, and you had interns, you had med students. I mean, what are your experience been with working with people who are really interested in cardiology and want to do it?
Yeah, no, that's really true. It's all about that growth mindset, people that are there to learn and are really looking to improve themselves. And that was real powerful what you mentioned, Dr. Kelly. And one thing that we always like to ask everyone on the show, and I can already hear your passion for everything that you do within cardiology and also your advocacy for making others kind of be able to follow that path that you did, is what makes your heart flutter about the field and about your daily day-to-day work with patients and advocacy for first generation immigrants.
I just love, preventing heart disease. I was blessed to work with Dr. Sperling, Dr. Kayumi, which are really great preventive cardiologists. And it's just catching disease at early stages, and working on preventing it. And that's something I love it. When I see an elevated calcium score, I'm like, that's great. We could just catch this and start early and working on the lipids, and putting on some aspirin, working on some of the risk factor. That's what I love, and also love, helping patients who already, secondary, tertiary prevention. So, I feel like a field is so evolving. I tell you this, when I was an intern resident, we didn't have Entresto, Farxiga, and all these drugs. I mean, these drugs are changing heart failure. It's amazing, right? Within 5 to 10 years, we have some of the best drug ever existed for heart failure. So I'm just saying, to me, is this is a wonderful thing just to be right now, be a part of a field that's evolving all the time, and I was working with cardiologists who've been practicing for 4 years when they tell me they only had nitro and heparin and digoxin back in the days. And look at now, those are drugs we just don't use first, So I'm just saying, the field is evolving so fast, and I like it, and just saving lives, honestly. And like I say, I tell everyone needs to see a cardiologist. Either you have a family who has the heart disease, or you don't have heart disease yet. And just unfortunate part of our society, how we eat and how lack of exercise is leading to this. But I think as cardiologists, we can motivate people by some of these early prevention methods, by saying, hey, you got a little, calcium score is elevated. Maybe we need to start exercising and working on your weight. And we also have more tools now for people to use too.
Yeah, definitely. It's so exciting about not just the medications, tools, but all that the future has within cardiology, the AI, and a lot of changing things within medicine. But it's been so powerful, Dr. Kelli, to have you here to hear about your journey and kind of where you got yourself, how you got yourself to this point today, and how you really carry that compassion and humility within you while you serve patients, but also while you serve the community from where you came from so that others can follow your footsteps. Your advocacy really speaks a lot, and it's been a lot to learn from you, but also a lot to reflect on as I listen to this recording again. Just really want to thank you for taking out time this evening to share your inspiring journey with the CardioNerds.
No, thank you so much. It's an honor. Every time I get invited to speak somewhere to speak, I feel very blessed because, years ago when I was applying to medical school, and again, I wasn't the perfect candidate. I'm the one who applied twice, and I was doubting myself at that time. Am I ever going to be a doctor? I don't think anyone cares about my story. And now sitting in front of you guys, sharing the story, just engaging, still very powerful and a blessing to me. I feel like I'm very lucky to be able to do that every time. So thank you so much for you guys' work and what you guys doing for the community and educating others too.
Yeah, thank you, Dr. Kelli. I learned so much more, even more so than I before I started the call. So I encourage anyone on the call, look into his work, watch the movie, go on his website, go on and see what products he's involved in. I think it's very inspiring. Not only if you want to be a future cardiologist, but just a future physician or any career choice path that you decide to take on. So I learned a lot, and I hope everyone can take the time to learn more. So thank you again for today.
No, thank you. If you have any question, anyone, just email me. I respond to all my emails. And that's something I made a promise to myself. If I become a doctor, I'm going to respond to everyone's email who email me about want to be mentor, what I want to get into medical school, what I do, whatever I want to do, what I'm doing right now. So thank you.